Thank you, Chairman. Good afternoon. Thank you for being here. I'm very glad to have this opportunity to share the podium for you. The pathophysiology of IC and the recurrent UTI is still unclear. The urocilian interstitial cell function, especially in cell regeneration and the tissue healing activity impairment, might have an impact on the pathogenesis of IC and the recurrent UTI. It may relate with urocilian denutation and the bladder function impairment, but the cause of urocilian barrier function defect is still unclear. The aim of our study is to investigate the interstitial cell function and the urocilian regeneration marker expression in the patient with IC and the recurrent UTI. The patient who was treated at our hospital for intravesical injection therapy were enrolled in this study. Before the injection, bladder biopsy was performed under general anesthesia. And the stretched urinary incontinence patient who was admitted for anti-incontinence surgery was also asked to provide bladder tissue during surgery as a control group. We use Western blotting and the IHC standing method, and our target is urocilian interstitial cell marker CD34, c-KIT, and the tissue regeneration protein, protoplanin. There are 10 females with recurrent UTI and 18 with IC, and 10 control group was enrolled. In IHC standing, most CD34 expression were found at superficial laminopropria, and most c-KIT expression located at deep laminopropria. This outcome is similar to the previous interstitial cell study of anal bladder. In Western blotting analysis, we can find in IC patients, protoplanin expression level were decreased, and their CD34 expression level were also mild decreased when we compare with the control group. This is the first study to investigate the interstitial cell marker, urocilian interstitial cell marker, and the tissue healing marker in human bladder. Our research revealed down regeneration of protoplanin and the CD34 in IC bladder. This finding suggests that the urocilian cell healing and the regeneration function impairment in bladder might involve in pathogenesis of IC. The limitation of our study is small case number and need future investigation. Thank you.
Any questions? Is there? Yeah.
Hello, Yoko Keita from the University of Pittsburgh. Did you confirm whether these cells were mast cells? Because c-KIT and CD34 can be expressed on mast cells as well.
The CD34 positive cell expression near the urocilian basement membrane might be associated with the uroepithelial cell regeneration, and the protoplanin expression might be associated with tissue healing.
Well, it's just that mast cells are also involved in inflammation as well, so that might be the reason why they're present in an IC or UTI patient sample. It's just to exclude that it's not a difference. It's not to actually confirm that it's interstitial cells and not another type of cell. because c-KIT and CD34 are both expressed on mast cells and interstitial cells. So it'd be nice to confirm that you are indeed looking at interstitial cells.
Did you understand the question? Do you understand the question? There are many different cell types in the mucosa, and the question was, how do you know that they are interstitial cells? Do you know if they are interstitial cells?
Thank you for your question. I think we have verified that the expression is also in the mast cell and the interstitial cell by the more detailed electron microscopic investigation and also the histopathologist. Yes. Okay.
One short question. You put together Hunner and non-Hunner interstitial cystitis, but then you have the picture, and then you put interstitial cystitis and just non-Hunner in the parentheses afterwards. Did you find difference between the non-Hunner and the Hunner's patients that you call have interstitial cystitis?
Sorry, I have to answer for you.
It's
I think
okay.
the IC patients enrolled in this study are non-ulcer types.
Okay.
Yes, and we found that the ulcer type, the non-ulcer type IC and the recurrent UTI patient bladder tissue have also like a result, lack of regenerative ability and increased the decreased the CK expressions. So that means that these bladder tissues have a less regenerative ability, maybe due to a chronic inflammation, and that caused a deficit of the barrier function of this bladder tissue. And that may explain why these patients have a prolonged recurrent UTI and also bladder pain symptoms. So this is the first step that we do, and we need further investigation in the future. Thank you.
Next.
Thank you. Thank you very much. Thank you.